Bacterial factors that predict relapse after tuberculosis therapy. Roberto Colangeli, Ph.D., Hannah Jedrey, Ph.D., Soyeon Kim, Sc.D., Roy Connell, mile/hour, Shuyi Ph.D., Umadi Chippada Venkata, M.S., Soumitesh Chakravorty, Ph.D., Aditi Gupta, Ph.D., Erin Sizemore, mile/hour, Lois Diem, B.S., David R. Sherman, Ph.D., Alexandros, M.B., Ch.B, et al., for the DMID-1009/Tuberculosis Trials Consortium Study 22 teams. Abstract. Background. Approximately 5% of patients with drug-susceptible tuberculosis have a relapse after 6 months of first-line therapy, as do approximately 20% of patients after 4 months of short-course therapy. We postulated that by analyzing pretreatment isolates of Mycobacterium tuberculosis obtained from patients who subsequently had a relapse or were cured, we could determine any correlations between the minimum inhibitory concentration, MIC, of a drug below the standard resistance breakpoint and the relapse risk after treatment. Methods. Using data from the Tuberculosis Trials Consortium Study 22, development cohort, we assessed relapse and cure isolates to determine the MIC values of isoniazid and rifampin that were below the standard resistance breakpoint, 0.1 μg per milliliter for isoniazid and 1.0 μg per milliliter for rifampin. We combined this analysis with clinical, radiologic, and laboratory data to generate predictive relapse models, which we validated by analyzing data from the DMID-1009 study, validation cohort. Results. In the development cohort, the mean, plus-minus Sd, MIC of isoniazid below the breakpoint was 0.0334 plus-minus 0.0085 μg per milliliter in the relapse group and 0.0286 plus-minus 0.0092 μg per milliliter in the cure group, which represented a higher value in the relapse group by a factor of 1.17. P equals 0.02. The corresponding MIC values of rifampin were 0.0695 plus minus 0.0276 and 0.0453 plus minus 0.0223 μg per milliliter, respectively, which represented a higher value in the relapse group by a factor of 1.53, P 0.001. Higher MIC values remained associated with relapse in a multivariable analysis that included other significant between-group differences. In an analysis of receiver operating characteristic curves of relapse based on these MIC values, the area under the curve, AUC, was 0.779. In the development cohort, the AUC in a multivariable model that included MIC values was 0.875. In the validation cohort, the MIC values either alone or combined with other patient characteristics were also predictive of relapse, with AUC values of 0.964 and 0.929, respectively. The use of a model score for the MIC values of isoniazid and rifampin to achieve 75.0% sensitivity in cross-validation analysis predicted relapse with a specificity of 76.5% in the development cohort and a sensitivity of 70.0% and a specificity of 100% in the validation cohort. Conclusions. In pretreatment isolates of M. tuberculosis with decrements of MIC values of isoniazid or rifampin below standard resistance breakpoints, higher MIC values were associated with a greater risk of relapse than lower MIC values. Funded by the National Institute of Allergy and Infectious Diseases.